Picture this. You're standing in the personal care aisle at your local pharmacy, staring at rows of intimate products, feeling completely overwhelmed and maybe even a little embarrassed. The packaging promises things like gentle and for sensitive skin, but you have no idea what's actually safe or right for your changing body. Sound familiar? If you've ever felt confused, frustrated, or even ignored when it comes to intimate care during menopause, today's episode is going to change everything for you. Welcome back to Pleasure in the Pause, the podcast dedicated to inspiring midlife women to connect to their bodies, pleasure, and power in perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, and I'm so happy to be back after our summer break. I hope you had a fabulous summer holiday, one that gave you space to recharge and reconnect with what feels good. I don't know about you, but September always feels like a fresh start. And what better way to begin than by kicking off Sexual Health Awareness Month? And before we dive in, if you love this podcast or find it helpful in your journey, please hit subscribe, share it with a friend, and leave a quick review. It helps this vital information reach more women who truly need it. Thank you so much. Today, I'm absolutely thrilled to welcome Dr. Anna Cabeca to the show. Dr. Anna is a triple board certified physician. She's board certified in gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She's also the best-selling author of The Hormone Fix and Keto Green 16 and holds certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. But here's what I love most about Dr. Anna. She's known as the girlfriend doctor because she's sassy, blunt, speaks from the heart, and has a fabulous sense of humor. She's exactly the kind of girlfriend every woman needs when navigating the complexities of menopause and intimate health. Dr. Anna has personally experienced menopause twice. Yes, twice, which gives her both the clinical expertise and the lived experience to deeply understand what we're going through. She's also developed natural products specifically for women like us, including Julva Cream for vulvar care and the upcoming Velve lubricant, designed especially with midlife bodies in mind. In today's episode, we're having the conversation that so many of us need, but rarely get to have. And what better way to kick off Sexual Health Awareness Month than by getting grounded in the foundation of sexual wellness, vaginal and vulvar care. And yes, there's a difference. Because sexual health isn't just about what happens in the bedroom. It's about physical comfort, emotional well-being, and our relationship with our bodies. Dr. Anna is going to break down what the vaginal microbiome is and how it changes in menopause, the real difference between vaginal moisturizers, lubricants, vaginal estrogen, and topical DHEA, the red flag ingredients to watch out for in drugstore products, and why so many mainstream options simply weren't made with menopausal women in mind. But this isn't just about choosing the right product. It's about understanding your body, advocating for your needs, and reclaiming comfort, pleasure, and confidence in this season of life. Whether you're noticing changes for the first time or you've been quietly struggling with dryness, discomfort, or drop in desire, this episode will give you the knowledge, tools, and reassurance to feel like yourself again. Because true sexual health begins with feeling comfortable, confident, and at home in your own skin. So let's get into it with Dr. Anna Cabeca. Dr. Anna, welcome to Pleasure in the Pause.
Oh my gosh, it is a thrill to be here. I love your title. It is genius on so many levels.
I'm so excited to have this conversation with you today, especially as we're kicking off Sexual Health Awareness Month. So thank you so much for being here. We met at the Let's Talk Menopause Symposium in Dallas earlier this year. And I have to tell you, the moment I saw you, I turned to my friends and said, oh my God, there's the girlfriend doctor. I had been following you for years because of your vulvar care product, Julva, which I have right here and I love, and we'll talk about it in a bit. But meeting you in person confirmed exactly why you've earned that title. You are truly the kind of friend every woman needs to have when navigating the complexities of menopause and intimate health. You're warm, you're knowledgeable, and so refreshingly real. Thank you again for being here.
I mean, I feel the same way. You have a magnetic personality. I was just drawn to you right away.
Oh, thank you so much. Before we dive into vulvar care, I'd love for our listeners to hear your origin story. How did a triple board certified OBGYN end up becoming an entrepreneur and creating a beautiful line of intimate wellness products?
Out of complete necessity. You know how they say your mess becomes your message? That is truly mine. And from my own trauma in 2006 that led to post traumatic infertility. It's really a thing, post traumatic infertility and early menopause. It took me on a journey around the world, really looking for answers. And I'd taken a sabbatical from my practice. And through understanding healing foods and healing modalities and the grace of God, I was able to reverse the early menopause diagnosis at age 39, which is like unheard of in the medical literature, very rare, and naturally conceive my child at age 41. I was told I would never be able to have. So that was a big impetus. And then from there, I came on fire into my medical practice to do things differently, to blend Eastern and Western medicine and lifestyle medicine, how important that aspect is. But then I still had underlying PTSD under the surface. I was sleeping, literally slept 3 hours a night for 8 years. And that underlying PTSD was there because I was worried something would happen to my daughter, or something could
Mm.
happen to anyone in my family. And I had this underlying, as much as we know, as much as I knew as a physician, I didn't understand that was happening. I think so many women experience, they just power through no matter the underlying storm that's they're going through in life. They're just one foot right after the next and continuing to power through. And so that was my story until I couldn't anymore. I was depressed. I was going through the second perimenopause symptoms like mood swing, brain fog. I couldn't manage my medical practice, my concierge practice. I had a med spa too. I closed it all down. And my patient said to me, they said, "Dr. Anna, no one will refill your creams, lotions, and potions for us because I've been compounding creams and customizing creams for my patients since 1999, especially when it came to vulvar and vaginal and sexual health." And so I had come up with a beautiful formula. So I told my clients, my patients, at the time, our ex-patients, I would come up with something over the counter that you don't need a prescription for that's better than anything I can write on a prescription pad. And I was committed during this time because I was like, I felt the guilt of not being able to be their doctor and yet torn to take care of myself and my family. And so I invested my time and research into formulating, and it took me 3 years to really fine tune this formula and to create Julva, to combine ingredients that are safe, effective, science based, good clinical research. And they work and it feels good and it's clean, no hormone disruptors in it. From that time, like in 2016, when I launched it to 2017, we had tens of thousands of customers. And so it really did change lives. I'm back in clinical practice now since 2023, but it was definitely born out of love and commitment to help others not suffer the way I had suffered, having had early menopause and big babies. And also, but as a surgeon, helping my patients deal with or prevent issues or heal from issues of vaginal dryness, incontinence issues, anal fissures, loss of sensation or orgasm. And this is it's a crucial it is essential for health. Sexual health is health, and you say this. So sexual health is health and it's such an important part of wellness, but really less than 1% of physicians address this issue.
So you went through menopause twice. Is that right?
Well, and then officially at age 56, I'm 59
Mm.
now. But yeah, so that at age 48, that perimenopause journey, that was all swings. It was elevated FSH, low, no periods again. And I was really spiraling. But the nutritional aspect and the lifestyle aspect is because I always say it takes more than hormones to fix your hormones. Because I learned this at my own story. At that time, my hormones were dialed in. But everything else, the mood swings, the brain fog, the irritability, the weight gain without doing anything different, that was all happening. So I was able to reverse that as well. And then officially menopausal age 56.
So you've been in this menopause space both as a woman going through the transition and as a doctor for quite some time. I'm so happy to hear that you're back in clinical practice. We need you, Dr. Cabeca, especially now. So I'm so glad to hear that. And I imagine as someone who went through menopause twice, you were probably your own first frustrated patient. You had feedback from your own patients at the time, but when it came to finding good intimate care products, what was your aha moment when you realized that what was available just wasn't cutting it for your patients or even for yourself?
Well, I tell you, I think back to a critical time in my early 2000s in clinical practice. First was this story in 1999 that I had a patient who was 63 years old, and she came into my practice. She was a CEO of a biotech company, and I'm in Southeast Georgia, a very rural practice that I had. She came in, she goes, I knew you were here. I knew you trained at Emory, and I'm 63 years old. I'm a woman of the 60s. I had a history of ductal carcinoma in situ of the breast. No one will give me hormones. I'm dry. It hurts. I have no sex drive. I love my husband. I rather die than live this way. Help me. Literally. And
Mm.
she's 5 foot tall. I'm 5'8", but she's 5 foot tall. You salt and pepper hair, black horn rimmed glass. I was intimidated. And then I was like, okay, let me look at my doctor's bag. And I didn't have anything. The two of us together, we went and looked at the research. I said, I need to figure this out. And I looked at the testosterone research, what was happening in DHEA, considering the hormonal cascade. What's true? What can we help? She had DCIS, not breast cancer, but what if it was breast cancer? How can I safely preserve her sexual function and genitourinary health? What could I do for her? So that's where I started compounding testosterone and DHEA safely and understanding that vaginal estrogen is absolutely safe. And these are how I started in this area. But then I still like would address these issues, but I was doing a lot of bladder sling procedures too as a gynecologist, and I trained in incontinence procedures, so bladder sling procedures. And during the early 2000s, you can remember billboards for mesh erosion. I'm like, I never want my patients to experience that. But if estrogen's only working on the mucosa, DHEA and testosterone can help rebuild the muscle and glands. So, what if I put them on vaginal DHEA and testosterone suppositories and topically around the urethra? We could approach it both ways. And how would that improve my surgical outcome? But okay, so this is the mistake I made, Gabriella, to be honest. So I could do 6 sling procedures in a day. So I decided, okay, let me pre-op, and I would give them hormones, but I'm like, let me pre-op 2 months ahead of time, or when I diagnose their incontinence, let me start giving them the hormones vaginally, testosterone, DHEA, or even just DHEA, so that I have good surgical tissue to work with. And so as I started doing this, and they'd come in a couple days before their scheduled surgery, after 2 months of using this therapy, they'd be, Dr. Anna, I no longer have incontinence. I ran 5 miles without a pad. I'm having the best orgasms. I'm like,
Mm.
number one, you don't need surgery, hence really decreased my surgical gynecologic income. Tongue in cheek, I say that. I'm so grateful that I learned this, and preserve their anatomy, help restore their anatomy. So that's how I really started using these DHEA as a prohormone and testosterone as an androgenic hormone to help with sexual function, bladder control, incontinence issues, vaginal pain and dryness, and orgasm issues. So it's over 20 years I've been doing this.
Amazing. And so I know you've channeled all of that clinical experience and knowledge and testing these well-known hormones, right? DHEA, testosterone, estrogen for quite some time into some of the products that you're formulating now. And we'll talk about that in a little bit. September is Sexual Health Awareness Month. And I think many people have a narrow view of what sexual health actually means. We've been talking about some of the aspects that are incorporated into sexual health. From your perspective as a women's health expert, what does comprehensive sexual health encompass, especially for women in midlife?
Yes. And it's such an important understanding because it's multifocal. Sexual health affects all our health. And it's so critically important for me because sexual health, intimacy, connection with or without intercourse, right? Partner, no problem. And it is that sexual health and wellness increases oxytocin, increases feminine energy, increases optimism and compassion. My experience as we have more oxytocin from increasing our intimacy and sexual health, that can be very powerful healing hormone. But sexual health encompasses vaginal health, overall digestive health. It encompasses our environmental health because hormone disruptors can affect our sexual health and function as well as anatomy. And so there's so many pieces: medical, physical, emotional, relational, mental, all that in the environmental. I always tell when I'm interviewing with couples about sexual health, I'm like, what's your sex space look like? What's your bedroom look like? What is a turnoff in your bedroom? And I remember a client saying, when he leaves his dirty socks on the floor, and I look
Mm.
at him, do you want more sex? I'm like, pick up your damn socks.
I know. That definitely matters. Just the sensory aspect of it is so something we overlook. That's such a holistic way to think about it. I love it. So, how does vaginal and vulvar care, which is what we're focusing on today, fit into this bigger picture of sexual wellness that you just described?
Yeah, especially because of my years as a gynecologist and a gynecologic surgeon and working with lifespan, blessed to work with young girls through 80s, 90-year-old women. And so seeing the changes that happen over time and what we can prevent, what we really need to prevent those changes, adverse changes from happening, such as the issues, the consequences of vaginal dryness, of atrophy of the genitourinary area, so the urethra, in causing an increase in that, just those changes alone and shift in the microbiome, the vaginal microbiome specifically, those shifts increase urinary tract infections, increase incontinence issues, increase vaginal dryness, decrease in natural secretions, and an increase in pH, which adds to increase in bacterial vaginosis infections or odors and things we don't want. So that thinning of the tissue and the most important anatomy of the body, in my opinion, I'm a gynecologist, and I always say vulvar vaginal health is more important than dental health, at least as. But we need the clitoris to anus, most important real estate of our body, because clitoral health, that's our pleasure, designed for pleasure, over 8,000 nerve endings. That is specifically designed for pleasure. That's it. Has no other function in our body but to give us pleasure. And that
Mhm.
will atrophy, diminish, and shrink as we age unless we address it. And for me, it's topical DHEA for that area. And of course, always pelvic floor exercises. And that's critically important. The vulvar tissue, and especially the vulvar vestibule, the opening to the vagina, is where our glands are the richest concentration. So, Skene's glands, Bartholin's glands, the secretions are designed for natural lubrication, for moisture, to help the vaginal pH be more acidic. But they dry up. Like I always compare it to dry eyes, right? As people get dry eyes as they get older, those are glandular secretions. Yeah, topical DHEA can help that too, but it's helping that way at the vulvovaginal vestibule. And then, of course, I remember doing like hemorrhoidectomies on people. You know, you like that is worse than a hysterectomy. It's one of the worst procedures to recover from. But if we can prevent that, keep that tissue healthy and stronger, we would want to. So again, pelvic floor exercises, but topical DHEA has worked really well and safely in that area to help with restoring normal anatomy. I trained with an amazing gynecologist. He was operating at age 82. He says, my goal as a surgeon is to restore normal anatomy. So I always thought about that. What if we can restore it without surgery?
Yeah, no, and want to talk about more about DHEA because I know it's such a key ingredient in Julva. But before we go there, you mentioned the vaginal microbiome. For our listeners who haven't heard of this terminology, can you just take a couple of steps back and just explain what the vaginal microbiome is and how does it change as we move through perimenopause and menopause?
I'm so glad you asked because I'm passionate about this. I'm actually lecturing to physicians regularly now at conferences on this issue. And I really want to get the word out because physicians don't know as well. I mean, we're untrained. And the concept of the vaginal microbiome has had a paucity of research in history. So now we're starting to get some studies in Trends in Microbiology released in 2016, a fascinating article talking about the vaginal microbiome and how important it is for all aspects of life, but yet again needs more research funding. And this is now with the concept of the gut microbiome. We're even having our gastroenterologists recommend probiotics and prebiotics, and the healthy gut microbiome is associated with diversity. Studies looking at native cultures like in the Amazon showed that the higher diversity of the gut microbiome was associated with less disease, less cancer, less cardiometabolic diseases, less diabetes, etc. And so the diversity is key. But the vagina is the opposite. The monodiversity is key. Predominantly less diversity in the vagina is healthy and predominantly lactobacillus species. Specifically, there's 4 key strains that are associated with healthy pregnancy outcome, healthy vaginal health, pH, low infections, low HPV, low to negligible risk of cervical cancer with these healthy bacteria within the vagina. And these are Lactobacillus crispatus, Lactobacillus iners, Gasseri, and Gensai. So those are key for healthy vaginal microbiome. And what happens, a healthy vagina has a very acidic pH, which makes sense because you want to kill off bacteria, parasites, only selectively choose the healthiest sperm and the toughest sperm. So the acidic vaginal pH makes sense because that's an opening into our body, into our womb. But as we age, it becomes more alkaline. And that creates more of the susceptibility to bacteria. HPV infections can worsen. So, yes, pap smears are required for life, maybe every 2 to 3 years or 5 years, depending. But pelvic exams for me are a really important part of health management because of HPV and because of the endocrine disruptors, the hormone disruptors, and destruction happen to our gut microbiome, which can be reflected in the vaginal microbiome. Any antibiotics, soaps, douches, things like that we've used affects that vaginal microbiome. So keeping that healthy is key. So I've really worked to have available for clients really healthy, targeted vaginal probiotics that can be taken orally or vaginally. And this is all really new with being able to have this available for clients over the last 2 years.
Is it the decline in estrogen that leads to that more alkaline state?
I think it's a combination of things because what's our mother hormones, I was to, how well you can see this. Actually, I can show
Mhm.
it. I could share my screen and show it better. But if you think of our decline of progesterone, 75% between age 35 to 55. And from progesterone and pregnenolone, we make DHEA, which then converts to testosterone and estrogen. So we have this decline in all these hormones, not just estrogen, because we know there are testosterone receptors in the vaginal mucosa, in the vagina itself, and in the muscle. So we know there are androgen receptors as well as estrogen receptors. So it's a combination of things. And that's why women who have childbirth, even in their later ages, can have more tears or abrasions potentially from childbirth because of the loss of the elasticity of the vagina. I'm like, I had a child at 41. I had a child at 30. There's a difference, y'all. There's a difference. And so knowing this information, I wish I knew it before the fact, but after the fact is really helpful for patients. So you get that decline, not just because estrogen works on the mucosa, helps with the moisture. So the
Mhm.
first layer of the vagina, like the inside of the mouth. But the DHEA and testosterone, even progesterone, works on the deeper layers so that restores the elasticity, the rugations, the natural folds within the vagina, as well as the glandular production. So the combination is really ideal. And that combination is really ideal. I wish there was a clean, prescription vaginal combination without hormone disruptors that I could recommend to patients. The closest thing that comes is the Vagifem tablet. Like estrogel has hormone disruptors in it and Premarin vaginal gel as well. I use compounding pharmacies, to be honest, Gabriella, and I have been since 99 because really customizing care for women with clean hypoallergic ingredients. And then when I came up with Julva, I'm like, it's got to be clean enough to eat because anything going in the vagina is going to be absorb is it's key. We don't want those hormone disruptors. We want healthy flexibility. We don't want to create damage.
Makes so much sense. And so we're talking a lot about the vagina, the vaginal microbiome, and what impacts the elasticity and the microbiome and the integrity of the vagina. There can be some confusion about vaginal versus vulvar care. So why don't we talk about that? Why don't we break that down for our listeners? Can you help us understand the difference between these two areas and why they need different types of attention?
Yeah, absolutely. And like this is, I always have my pelvic floor model here for those that are viewing. But when we think of the external anatomy, so on the outside, and everyone can, I encourage this, I always encourage this to my patient and my online community members is get a mirror, look at your anatomy. What is normal for you? And from here, this external genitalia, this entire area, like here we have the vulvar area, and the perineum, and also the anal area. So in this beautiful diamond-shaped area of our body, we have tremendous amount of nerve endings. Like I said, I think we've estimated over 8,000 nerve endings in the clitoris and a tremendous amount of blood vessels. And the vascular supply is really rich. All of that diminishes as we age unless we're doing something actively to preserve it. So in this area, just like we get fine lines and wrinkles, I like to laugh lines, smile lines. I don't necessarily love my forehead lines, but smile lines, laugh lines, all of that. As we get those lines, it's also happening down in our pelvic area. But the problem is it can further relate to that atrophy, that genitourinary atrophy, the incontinence symptoms, the dryness, the discomfort that can happen, and the change in a healthy vaginal microbiome. So when we think vulvar vaginal area, that's this entire area, the perineum also including the anal looking. I like to include the anal tissue in this area because it's also a sex organ. It has high amount of nerve endings, also designed for pleasure. And this external vulvar area is very sensitive too for sexual health. This is key, the vulvar area is key to increasing that vaginal stimulation of this area is key to increasing that vaginal secretions and moisture. I say if you go down a water slide that isn't wet, you'll know why foreplay is so important, right?
Yes,
So that
exactly.
this perineal, this external area is also key as well as any other erogenous zones in our body to naturally stimulate these secretions and awakening of the nerve endings. So that becomes really important. So when we think of vaginal, and this opening here is the vulvar vestibule or the vaginal vestibule, vulvar vestibule, and that is where a lot of the glands are right at the opening of the vagina. And so this external area, the lower third of the vagina, has the most significant nerve endings. There are other nerve endings at the G spot, A spot, cervix can be pleasure zones too, but definitely clitoris, vulvar, vaginal vestibule, anal area are also pleasure zones.
But those are all external. So you mentioned
External.
The G spot, the A spot, those are all internal, right? So everything that you're talking about right now is all external.
Yep.
Okay.
Yes. And it's often neglected, especially in the conversations about vaginal estrogen. Again, very helpful, but the androgens really help a lot too. And the pro hormone DHEA helps a lot too in this area as well.
Okay, wonderful. Thank you so much for explaining that. So why don't we break down the different categories of intimate care products? Can you explain then the difference between vaginal moisturizers, sexual lubricants, vaginal estrogen, and we've been talking a lot about DHEA and when a woman might need each one?
Yeah, so I always like with the hormone decline, progesterone declines first. DHEA actually for both men and women peak in our mid-20s and starts to decline, and DHEA converts to testosterone and estrogen. So I like to use DHEA first, and there is prescription DHEA prasterone or Intrarosa that is a suppository that can be used vaginally. A lot of good research on that and safety profile with it, but it also DHEA and testosterone and estrogen can be used externally, clitoris, vulvar vestibule, anal tissue. So these when we think of a moisturizer, we think external moisturizer or vaginal moisturizer with hyaluronic acid. Aloe vera is a good combination. So we think of these as moisturizers to help restore the natural moisture, reduce those fine lines and wrinkles, to help improve the flexibility and reverse the hands of time, really, the youthfulness of this area. And we can do that. That's why we invest so heavily in cosmetic cream. Well, I do. And so when we think of a moisturizer, we think of these ingredients that help to ideally naturally restore moisture. When we think of a lubricant, it's more superficial. And so it helps with the slip and slide. And it was really in all these years, especially working with fertility and now a lot of infertility issues post pandemic, really seeing a significant amount. And I think in my clients, especially, what's the cleanest lubricant we can use? And I searched far and wide to find nice, clean ingredients for that. And what I like is, and I would say a DIY, everyone listening can make your own lubricant very easily, and I use a liquid organic aloe vera,
Hmm.
50/50 proportion to a fractionated MCT oil, and so that's liquid at room temperature because it's for example, coconut oil is a great lubricant as well, but it is solid at room temperature. It melts very quickly. But fractionated MCT oil is liquid at room temperature. So you can mix it with the aloe vera and add 1 to 2 drops of your favorite essential oil that turns you on. Like I love frankincense and rose. Like
Mm.
those two for me are lovely, but
I
it's
love
what's
frankincense. Yeah, frankincense is one of my favorites.
I love it, and for me, it's like an erotic, deep, earthy smell. So you can add 1 or 2 drops of frankincense or rose or whatever essential oil you like. Some people like orange, some people like, mint type, and that can be very stimulating too. Just a drop goes a long way, and that in that combination of aloe and MCT, you do have to shake it up. You can put it in a pump bottle and have that at your bedside. Inexpensive to make, will last a long time, is healthy for the vagina, and definitely creates that slip and slide feel. And I went on to create this year, releasing very soon, is a lubricant already made with aloe vera and hyaluronic acid, with some stimulants like cupana seed extract and ginseng to help with blood flow, circulation, stimulation also. But that is designed for slip and slide. That's designed for play, where I say, Velvet is for play and Jelva is for every day. So that combination works well. And we know from statistics that 65 to 75% of people have increased pleasure with using a lubricant. I think this is really important too as we age. So we don't have discomfort or condom trauma or tissue trauma from intimacy too.
And so those are in addition to the use of vaginal estrogen or DHEA if you're using it separately to restore the integrity of the vaginal tissue. We've had lots of conversations here with other gynecologists and urologists about the use of vaginal estrogen and DHEA as intrarosa as you speak to address the genitourinary syndrome of menopause. But you're talking about these other products, lubricants and moisturizers that we should use in addition to those more medical products.
Yep. Yes, absolutely. That is like part of specifically this having topical moisturizer or topical hormones, even or moisturizers for external genitalia, increase pleasure sensitivity and orgasm as well as decrease. And the same with interosa, decrease in urinary incontinence issues with, I will say, with pelvic floor exercises, you can feel these benefits.
And so I love that you focus a lot on these very pure, natural ingredients. What are some of the red flag ingredients women should avoid in over the counter intimate care products and why?
Definitely the preservatives,
Mm.
and I've seen lubricants with aspartame in them.
Oh my
So,
goodness. Wow.
I know we have, and so aspartame, parabens, any, like, preservatives or chemicals, and so they're designed to keep the preservatives and some of these chemicals that are used in the parabens are designed to increase shelf life, which makes sense. Mine have 18-month to 2-year shelf lives because I'm not adding these other preservatives in there, and there's a reason. I know that we look for the hormone disruptors. So we think of these things as hormone disruptors, and we want that to be clean. Other things like glycols or oh gosh, there's a long list. I did a whole article on it on my
Yes,
blog.
I read that article on your blog. I'll post it in the show notes. It was so helpful. Glycogens, is it glycogens and glycols? I don't know if they're the same thing, but those are the 2.
Glycols, petroleums, all of
Mhm.
like that. When I hear that people are using petroleum jelly or KY jelly, and that's a disservice. I'm currently, even in my gynecologic practice now, I use the Velvet. I'm like, we're just gonna use this as a lubricant because even for vaginal exams or for pap smears, we want it to be clean and not disruptive. And also, I don't want to be contributing to chemicals inside
Yeah,
the
I'll
vagina.
make sure to include that list of ingredients in the show notes with the link
Thank
to
you.
that blog piece, which was so helpful. So tell us about Jova. I was so intrigued by the ingredients when I started using it a few years ago, specifically the use of DHEA and alpine rose. Can you walk us through why you chose those specific ingredients and how Jova is different from using just any other vulva moisturizer?
Yeah, so because I patented this formula. I combined the alpine rose plant stem cells when I was looking at, okay, I want this to be really, really effective. And as I dug into plant stem cell research and what's being used in cosmetic lines, I came across the research for the alpine rose. And this is a rose that blossoms in the harsh conditions of the Swiss Alps. So think rocky terrain, icy winters, and it blossoms. And I think if that doesn't represent femininity in our second half of our life, post midlife, what does, right? Blossoming despite the hard conditions. And the research on alpine rose plant stem cells showed that they reduce fine lines and wrinkles. They help with collagen production. They have an antiviral property as well. And you think, okay, HPV in the vagina, we don't want that. And if we can do anything to decrease it versus increase it, I looked at that research and said, no wonder it's in high end cosmetics. I really like the research on the alpine rose. So I started experiment with different stem cells and different plant stem cells and found the alpine rose to be really effective in the vulvar area. Then DHEA topically, it again to address these issues is important and underserved and has a tremendous amount of research. And then I wetted these ingredients so they absorb well with the emollient base so that it really helps drive the ingredients deeper into the tissue and again is clean.
Amazing. Have so enjoyed using Jalba. I do notice that there's a little bit kind of we were talking about this before we got onto the call. There's a little something, a little kind of stimulating kind of, ooh, I noticed something is going on down there. And I know that you recommend using it before intimacy, something that kind of stimulates blood flow or just awareness of the vulvar area. What is that?
Yeah, I say it's awakening ingredients, awakening combination. I really think it is the combination of ingredients, but especially the DHEA can have that, we know that can improve vascularity and blood flow and the alpine rose plant stem cells as well. So I think that's why it works. I have a physician colleague who's like, okay, if Julva is good for mom, well, let me try this packet. Have the sample packs that have 7 days worth of Julva in it. And he's, let me use this whole packet. And he was like, oh my gosh. Like because I was worried I was going to have to go to the ER because he had an erection for like 4 hours. Like, okay, we just start with half a packet, like not the whole packet for guys and a little bit of amount. And the other thing I wanted for my clients was something that was safe if they have a male partner. First of all, that it's well absorbed and if they can use it during intimacy that it has positive effects for their male partner, not negative effects.
So beautiful. And thank you so much. You're offering our listeners a 15% off promotional code on their first purchase of Jelva. So I'm so excited for everyone to try Jelva. I highly recommend. I've been using it for a few years and it's wonderful. I use it on the days that I'm not using vaginal estrogen. I do feel it just keeps the tissue moisturized and plump. And again, just brings that little bit of, ooh, there's something going on there. There's sensation there, which I love. Before we say goodbye, if a woman is just starting to think about vulvar care, maybe she's never used anything beyond soap and water, what would you recommend as a good beginner routine? What's the foundation everyone should have?
Definitely. First of all, it's what can we eliminate from our skincare routines? For example, if we're using certain soaps or perfumes or feminine washes or body washes that have hormone disruptors in them, parabens, phthalates, etc. We want to eliminate that. We really want to reduce our exposure to that and use just clean ingredients. So that is where, for me, it's Julva is part of my daily routine. And for me, it's daily. I'm 59 now, so it is daily. And I also recommend, again, like aloe vera or hyaluronan topically on a periodic basis can be very beneficial as well. But really look at the ingredients, look and see what's clean. How does your body receive it? Anything you try, test it on your inner arm like we would do a skin test and
Mm.
see. We've done this clinically on 100 clients testing Julva topically specifically in my research and development of it and found zero response. But the vulvar vaginal area, if there's lichen sclerosis, if there's significant atrophy, if there's a dormant yeast or bacteria, and then we get into this environment where Julva is designed to work and create that healthy cell turnover, but it also restoring your moisture. So if you go from the Sahara to the Amazon, we
Mhm.
want to eliminate that risk of yeast infection or just treat it really quickly with a diflucan or a monostat or terconazole or some or antifungal just to eliminate that. It won't come back typically. So we want to be cognizant. We are restoring the moisture. We want to do it safely and wash just there's no reason to douche or anything like that because the vagina is also naturally cleaning. A bath, clean water, clean soap. I like olive oil soaps. I grew up with that, so I like clean olive oil soaps, very simple that way, and make sure that any other products, skincare, et cetera, that I'm using are clean. I think that's really important. There's so many good options now we didn't have 20 years ago that we can use.
Thank you so much for that. I know there are women listening who might be suffering in silence with discomfort or feeling too embarrassed to advocate for themselves. You've been such a champion for women's intimate health. What's your biggest piece of advice for those women? How can they find their voice and prioritize their intimate wellness?
I think that's the first thing is not feeling fear about expressing what you're feeling, expressing your voice, especially with physicians, providers, and if you've been post menopause or post hysterectomy, and they're like, "Oh, we don't need to evaluate." I had a patient in my office yesterday, Gabriella, who is only 47 years old, and she hadn't had a pelvic exam or pap smear since the birth of her last child, which was 12 years ago. And I was like,
Mm.
well, that's the first thing we're going to do today. We need to make sure all of this is up to date and examine the vulva. And I always say, also look what's normal for you and start feeling what feels good to you. In my course, Sexual CPR, I teach that understanding your anatomy, which is key, what's normal for you, and what are some things that could be blocking your sexy, could be blocking your sex drive, whether it's emotional, whether it's like a medical, an over the counter antihistamine can affect our orgasms, SSRIs can affect our orgasms. So, like doing an inventory of what's serving you, what doesn't serve you, and empowering yourself to heal always and always advocate. I think it's just about advocating for yourself, opening up the conversation, start having it. Women need to start talking about this more and more.
And you mentioned your course, Sexual CPR. I've walked through all the modules. They're incredibly informative and empowering. I'm going to include a link to that course. I feel that's a good sort of entry point into this whole world of sexual wellness, advocating for yourself and prioritizing your pleasure. So thank you so much for creating that course. I'll make sure to include that. Dr. Anna, this has been such an incredible conversation. I know our listeners are going to walk away feeling so much more informed and empowered. Before we wrap up, where can our listeners find you and learn more about your work? And how can they get their hands on Java and stay updated on the launch of your upcoming lubricant,
Y
Velve?
Yeah, absolutely. Thank you for that, Gabriella. I'm easy to find at dranna.com, so DRANNA.com. And my products programs, my podcast is a wealth of information anywhere you listen to podcast. My books, The Hormone Fix, Keto Green 16, Menopause are all like the food and lifestyle aspects and also talk about oxytocin and stress and hormone disruptors. I really feel like my book, The Hormone Fix, is foundational, good place to start. and it's available on Amazon and anywhere books are sold. So those are really good ways. And of course, social media at The Girlfriend Doctor.
Wonderful. Thank you so much for being such a generous guest and for sharing your expertise with us today. You truly are the girlfriend doctor that every woman needs in her corner. Thank you so much for joining me for this episode of Pleasure in the Pause with Dr. Anna Cabeca, the Girlfriend Doctor. I hope this conversation gave you the insight and the permission you've been waiting for to prioritize your intimate health and ask the questions that matter. Because when it comes to your body and your well-being, no question is off limits. As we continue celebrating Sexual Health Awareness Month, I invite you to take one simple step this week. Whether it's talking to your healthcare provider, exploring one of the products Dr. Anna mentioned, don't forget to check out the show notes for a special promo code, or simply tuning into how your body feels and what it's asking for. Your comfort, your pleasure, and your confidence are not luxuries. They are your birthright. If this episode resonated with you, please take a moment to subscribe, rate, and review the podcast and share it with a friend. Your support helps this important conversation reach more women who need to know you are not alone and your pleasure matters. Thanks again for tuning in. Until next time, may you live your life in pleasure.